Mr. Elston, thank you very much for joining us here at the Institute of Cultural Diplomacy and for your excellent speech. We would like to hear your thoughts about some salient issues. For example, you are involved in the SEED scale approach and how we can use it in cultural diplomacy today.
I think the deal with seed scale, since it's based in from the ground up, having multiple communities involved, and well, it's a grassroots approach to community development, I think that can relate to cultural diplomacy, in that we can have local leaders get together, people who are more so representative of the actual people, less so than kind of politicians who oftentimes lose touch with their own constituencies. So what I learned from seed scale that would directly relate to cultural diplomacy, that we should build trust on the ground level of the actual constituencies of sovereign political bodies. I think trust on that level will go much, much further than politicians who have been elected, who have been in office, and who have lost touch with their constituencies.
You were talking about new fascinating tools in which we can approach mental diseases. Can you tell something about that?
Yes. So it's well known there's a stigma associated with mental disease. And I think a big part of it comes from the word mental itself. Whenever people hear the word mental disease, they think it's something that we can't point to, something that's kind of in the air, something that may be personally wrong with you. You were born with a sick mind. I think, well, it's not really I'm thinking, it's the data clearly shows this. Mental disease is brain disease. Mental health is public health. And with recent advances in neuroscience, particularly in neurosynchrony, which is my subfield, what I work in, we can now point to very, very specific physical phenomena in the brain that are characteristic of what we call mental disease. So I think the big paradigm shift is going to be from mental disease to brain disease, and I think the principle of neural synchrony, that multiple parts of the brain are working together to produce normal consciousness, and that when parts of the brain that should be communicating don't, that is a mental disease. And the fact that we can describe that provides a very compelling bridge from conceiving of these conditions as something mental, abstract, to brain, physical. And I think the best part about this bridge of neurosynchrony is that we can do something about it.
And this technology is quite affordable?
Yes. This technology, to use neural synchrony, will cost less than $2,000, US dollars. All you need is an EEG machine and a person who knows how to read an EEG machine. And a quick Google, if you Google buy EEG machine, you can find like one of the nicest ones possible for somewhere in the neighborhood of 2,000 US dollars. And the computer program you need to use this is called MATLAB. And if you don't want to pay for MATLAB, you can get something called EEG Lab, which is free. And the really exciting part about this is that since it's so low cost, and the only real training that's required is to learn how to just analyze the information, virtually anyone could use this anywhere in the world and be globally contributing to our understanding of the human condition.
As I understood, it's like pretty affordable, easy, and why we are not using it?
I think we're not using it because it's, well, to be completely honest, I don't know. I've really thought about this a lot. I think it's not being used now widely because it just hasn't made it out of academia. It's been in the literature, in the scientific literature, since the mid-'80s, and it's been substantially growing. now even faster. And I think it's one of those things to where it's just hasn't made it out of the academic circles yet. And so the science is there to translate this into a global therapeutic solution.
Unfortunately, today we are witnessing very bad economic situation, especially for young people. Unemployment rates are very high. What do you think? Does it influence the mindset and mental health of young people?
Absolutely. I think the best way to think about how it is the current economic situations in fact impact mental health could be specifically learned helplessness. People, especially in welfare states, will get onto the government dole. They will basically realize that there is a safety net always, which is something I think is great. I think that's a really good thing. But for all of those pros, the con is that it's very, very easy, and many people do it, where they just take the government for a ride. Or beyond that, they get into their mind that because there is no job for me today, there will be no one for me tomorrow. And they develop this learned helplessness, which is often related to depression. And as you can imagine, in addition to just the lost productivity for that one person, depression affects all of us. Mental health affects all of us. Just simply because we are social beings by nature. And if someone you're close to isn't feeling well, it affects you too. So I think we have a responsibility to, number one, remove the stigma of psychiatric illness through understanding that there's nothing wrong with that person intrinsically. And then number two, to realize that I would be very depressed too growing up in this era and not having any sort of future or any sort of thing to look forward to. So I think time, place, present, past, and future all are very large factors that we should consider when discussing mental health.
Thank you very much. It was a pleasure to have you here.
Thanks.